Welcome, everybody.
The people in this room at Rose Medical Center know the importance of routine breast health screenings.
And because I'm one of the lucky ones, because I had an early diagnosis.
But Dr. Paige Dorn, a radiation oncologist,
I'm really passionate about that.
and Dr. Kayla Griffith, a breast surgeon,
We oftentimes forget to step back and take care of ourselves.
they know all too well what happens when people who are recommended to get a mammogram delay it.
It was pretty bad for a while, even the state of Colorado, which has been a little more progressive, shut down screening mammograms.
The shutdown of screenings lasted a few months, but these doctors say many people who should have been screened delayed it by 2 years.
We saw very little breast cancer compared to our usual volumes. And now what we've seen is that the catching up is resulting in patients entering with later stage disease.
Catching up comes with a cost.
The diagnoses we were having were much more progressed, meaning we had to do a lot harsher surgery, more difficult surgeries.
Modern technology means Dr. Griffith and Dr. Dorn can reduce side effects by treating smaller areas, but that can only happen if the cancer is caught early.
I think as providers of healthcare, it's disappointing, and I think patients feel that disappointment as well. The trade-off of what we feared during the pandemic and then having to deal with something equally or more concerning as a consequence.
Doctors recommend people who are biologically female and at average risk of breast cancer to get a mammogram every year beginning at age 40. But of course, everyone should check with their own doctor. Everyone has different circumstances. I'm 33. I've never had a mammogram. But Alex, I understand you have.
Yeah, I had one at 37 after I had my daughter. I mean, full transparency, I went in thinking I wanted a breast lift, going for plastic surgery, and they're like, okay, well, you have to get a mammogram first. I was 37, and they found a mass. And I would have never known, right? Especially if I waited until I was 40. So I think that point of going in and talking to your doctor regardless of what age, because what a blessing that, is kind of a roundabout way, but I ended up having to have surgery and having it removed.
Yeah, it's never too early to talk to your
100%.
doctor about this.
And they talk about those age limits with other things. You talk about colonoscopies and how they've lowered those ages now where they start recommending things like colonoscopies, and you wonder, if stories like that might see the age for a mammogram move. I know they don't like to do too many procedures, but it might be something they'll be looking at.
Yeah, absolutely.
All right, important stuff. Katie, thank you.